Welcome and thank you for joining this webinar on Physicians Quality Reporting System. My name is Kash and I work as a Meaningful Use Coach here in MTBC. With me I have Faisal. He is working as a financial analyst.
Hello everyone.
Faisal has got in-depth knowledge about PQRS program and he will be jumping in and out to tell us more about PQRS and its features. Before we get started, let me first of all go through the webinar logistics. All attendees are joined in listen-only mode. This means that at any stage, if you would like to ask a question or would like to leave a comment, you can use the webinar panel that you can see on either sides of your screen. Just type in your questions in the questions section and hit the send button. By the end of this webinar, we will have a question and answer sessions. We will try to answer as many questions as we can, but in case if you're short of time, the remaining questions will be answered via emails. Let me also tell you a bit about MTBC. MTBC was founded in 1999 and is currently serving 35 unique medical specialties in 39 states across the country. We now have more than 1,000 employees and we have 24/7 operations. We are ranked among the Deloitte Technology Fast 500. We are also Microsoft Certified Gold Partner. We are also listed on Inc. 500 5,000 companies. We are SureScript certified solution providers and our EHR is ONC certified. So let's get started with today's webinar. In today's webinar, we will be discussing about what PQRS is, its overview and its importance, how to get started, how to select reporting options and quality measures, then how the CMS will determine if the provider can go for an incentive or for a penalty, and then how MTBC can assist you in PQRS reporting. And then we will also be explaining you another option which is called as administrative claim that will basically allow you to avoid the penalty just for this year. Let me have Faisal and he will first of all explain us what PQRS process is.
Thanks, Kash. So basically the process will start where provider will check out either they are eligible to participate in this specific reporting system. So we have a list of eligible professionals in the next slides, which we will explain later. So let's say the provider is eligible to participate in it, and MTBC will contact that provider, asking him to start using our system in order to comply with the PQRS reporting requirements. So they will select their reporting method, the method which best fits their practice. And then they will also select the quality measures which they normally use in their daily workouts. So they will confirm the individual measures or a measures group to report to MTBC, and MTBC will then provide them relevant PQRS forms to capture necessary clinical information. This clinical information will help MTBC to determine the quality data code which can be applicable on that claim. Once MTBC will confirm that QDC, MTBC will submit the claim along with that applicable QDC to CMS. CMS in return will send us a denial code N365, which will indicate that this claim is now successfully recorded in their history. This whole process will carry on for the whole 2013. And in 2014, CMS will analyze all the claims submitted to them, and then based on the results, they will decide either to give provider a penalty in 2015 or to award them with the incentive. Also, MTBC will keep you updated with your progress throughout the year.
Now let me give you an overview of PQRS. PQRS again stands for Physicians Quality Reporting System. That is a program that is introduced by the CMS, that is Centers for Medicaid and Medicare Services. We will also be telling you who are the eligible professionals to go for this program. Either they can earn an incentive or how to avoid a penalty, then how CMS will determine if the eligible professional will be getting a penalty or will be receiving an incentive. And also 2013 would be the performance year for 2015. Based on 2013 progress, your incentives or in order to avoid the penalty will be discussed in 2015. And then we will be also telling you what are the different ways to participate in this program. On your screens, you will be able to see a list of all the eligible professionals, Now it includes almost all the professionals. That includes physicians, that are podiatrists, oral surgeons, chiropractors, also the nurse practitioners, like a certified registered nurse or audiologist. It also includes the list of therapists that are physical therapists or occupational therapists, and also the physician assistant can participate in this program. How to get started? Basically, there are two ways how an eligible professional can get started. Either that professional can go for individual majors or can go for major groups. Now, it's important for the provider that either they can go for like as a group practice. If there are more than two or more than two providers in the practice, they can go for the group. Or if that's a solo practice, then the professional can go for the individual. Now, let me tell you that both of these categories have different requirements. So based on your specialties, there will be different requirements for both of these categories. Then you just have to determine what reporting method best fits your practice. Once again, here we will focus that based on your specialty, what will be the best measures that you can adopt. Then comes the reporting options. So like I said earlier, that there are two methods to which you can report your majors. Either you can go for individual majors or you can go as majors group. I'll give you an overview of an individual. The individual professional must report via claims, registries, or EHR in order to qualify for the incentive and to avoid the penalty. There's also an administrative claim option that we'll be discussing in detail later in this webinar, and that is basically either you can report just one major or you can adopt that option in order to avoid that penalty.
Okay, thanks, Kash. I will be explaining about the group practices, how they can participate in this PQRS program. So for the group practices, they must self-nominate themselves by October 15, 2013. That's the CMS requirement that they have to register themselves. So further, CMS classified group practices into three different categories. The first category is 2 to 24 physicians, like the practices where there are 2 or more than 2 providers but less than 25 physicians in it. They have to report via registry to qualify for the incentive. So that's the must requirement for them. And they can also report via EHR, but that option will only be available from next year. Or in order to avoid only the penalty, they can go for the administrative claim option, or they can just report one mayor in it. So let me just clarify a little more on this, just one more mayor, which you also seen on the last slide. Basically, if you want to go for the individual mayors option, then you have to report minimum 3 mayors in order to qualify for the incentive. But if you fail to report 3 mayors and you only report 1 throughout the year, then CMS will assess your performance according to the guideline they set, and then they will decide either to avoid the penalty on your Medicare reimbursements or not. But that will be solely dependent upon CMS decision. So let's talk about the second category of this group practices, which is if there are more than 2 or less than 100 physicians in it. They can also participate by using above options, like they can report via registry, and they can also go for the EHR options starting in 2014. But also CMS introduced a GPRO web interface tool for them. That's the group practice reporting option web interface tool. That's only for the practices where the physician number is more than 25. Also, the last category is for the larger groups, larger practices where more than 100 physicians. They not only need to self-nominate themselves in order to avoid the penalty or like to tell CMS that they want to participate as a group practices, but their self-nomination is also necessary in order to avoid value-based payment modifier. That value-based payment modifier will kick in for these larger practices where CMS will assess their performance against the same size of group, and then they will see either you provided the best quality in low cost or not. And in case your performance is not equal to the performance of the other group, then you will be charged 1% of your total Medicare reimbursement in 2015 on top of 1.5% in PQRS. Also, you can seek the quality tiering evaluation by CMS, which may result in an incentive payment. Okay, so as we told, there are several methods to participate. The best one and the one which MTBC is offering is claim-based. Why I said it's the good one? Because in claim-based, in order to achieve the incentive, the requirement is 50% successful claims. So that's the CMS requirement. If you hit the 50% satisfactory level, then you can qualify for the incentive. However, in case of other reporting methods like registries or EHRs, this requirement is almost 80%. Then, as I told you, claim-based is one of the reporting method option. Then you can also use certified registries. These are the companies which are certified by CMS to cater this specific method. Then you can also use certified EHRs, and you can also use the group practice reporting option web interface tool. And also the last method is administrative claim-based, which we will explain later in the presentation.
Now, if you talk about the report options, in your screen you will have a clear idea what major groups would be and what individual majors are. Basically, in terms of individual majors, there will be a set of majors available that, based on the specialty, any eligible professional can adopt. If you talk about major groups, again, there will be a series of those majors that the provider has to adopt in order to go for the incentive or to avoid the penalty. Now, if you talk about the individual majors, there would be about 138 individual majors that MTBC will be taking care of. And out of those, the professional must report a minimum of 3 majors. Again, this is totally based on the provider's specialty. Based on that, at least 3 majors must be adopted. Then the professional must have a performance rate of greater than 0, and the reporting period would be the entire calendar year. That will be starting from January 1st, 2013 till December the 31st, 2013.
Okay, and the second reporting option is majors groups. So just like the individual majors, let me just explain the individual majors. There are total 259 in, but only 138 are applicable through claim-based reporting method, which MTBC is currently offering. And the same goes with the majors group. There are 22 diagnosis-based major groups which can be reportable via claim-based reporting option or through registries. And out of those 22, only 12 can be reportable using claim-based reporting option. Again, you have to report minimum 1 major group in it, and that major group should be applicable on minimum 20 Medicare patients in 1 calendar year. That's the requirement by CMS, and if you achieve that minimum standard, then you would be qualified for the incentive. Again, the performance rate should be greater than 0. If it's is equal to 0, then you will get penalty straight away. There won't be any other alternative available. And the reporting period is the same calendar year, which is starting from January 1st, 2013 up to the end of 2013. This slide has the list of those 12 major groups which can be reportable through claim-based reporting option. So as we can see, the first one is asthma, which has 4 individual majors. So as I explained previously, these are the individual majors which are combined into groups based on their diagnosis. So for the asthma, if you want to go for the individual major options, you will have 4 different majors to choose from. However, if your practice or your specialty covers only asthma, then you can use this asthma group to report. But that's totally up to your choice. Okay, the main part is the how CMS will determine the incentive or penalty. Again, you have to report minimum 3 individual majors or 1 majors group in order to be qualified for the incentive. CMS will assess your performance, and as we are talking about the claim-based reporting method here, you have to achieve minimum 50% satisfactory level in order to qualify for the incentive as well as avoiding the penalty. In case if your performance level is less than 50% or is equal to 0 in 2013, then there would be a 1.5% penalty on each Medicare claim in 2015. However, if you will get this 50% satisfaction level, then you will get the incentive of 0.5% of total Medicare reimbursement in 2013. How MTBC can assist you in this whole process? Like, you can choose, we will help you to choose this reporting option, which one you want to go for. MTBC will contact the clients and will guide them step to step how they can go and start reporting this PQRS. So first of all, we will help you to choose this reporting option. Either you want to go for individual mayors or mayors group. We will provide you details of both system and how they work, and then you will choose which one best fits your practice. Then you will select the mayors that fits your specialty or the services you perform. We will provide you with relevant PQRS forms. These PQRS forms are very important because they will help us to capture necessary clinical information which will help us to determine the appropriate quality data code. Once we will get those information, then we will enter those quality data code onto the claims. So for our EMR practices, we will provide you our EHR, which has this feature built in. So which means all you have to do is just enter the ICT and CPT and select the necessary clinical information on it, and applicable or the appropriate quality data code will be assigned to it automatically. However, for the non-EMR practices, we have already incorporated the necessary improvements in our system, and also our teams are fully trained on it, how they can enter these quality data codes on the claims. Once everything is done, all you have to do is just sit back and relax, and we will do this work of submitting to CMS. Also, we will keep you updated with your progress throughout the year.
Right now we talk about this administrative claim-based option, and basically this is an option that is introduced just for this year in order to avoid the penalty, and it can help you to avoid 2015 and 2016 penalty as well. It requires a submission of quality data codes on claims, but this claim is not necessarily required. But for this option, a registration is required, and the guidelines how to get registered and how to submit that information will be provided by CMS in this summer. There's the drawback for this option is that there's a limited number of quality measures. Now that can be related or that can be unrelated to your specialty. So the chances are, let's suppose if you have adopted this option and maybe you can't find the quality measures that comes under your specialty. So here we will strongly suggest that you have to take a proactive approach and just choose to report PQRS measures in order to avoid the penalty. We will strongly suggest not to rely on this option because, once again, that the measures that will be provided under this claim might not suit your specialty.
Yeah, thanks, Kash. Let me just quickly add one more thing in it. As Kash told, there is a limited number of quality measures which could be unrelated to your specialties. There are only 17 quality measures available under this. So you can understand if you take the proactive approach, then you can choose from the range of 138 quality measures. So you can easily find the quality measure which perfectly fits your specialty. But if you go for this particular option, although you don't need to do the submission of quality data codes, but your performance might get assessed on the quality measures which does not relate to your specialty. And let me summarize this whole presentation. You will choose the reporting option and the measures to report. MTBC will provide you PQRS form which will help you to capture clinical information necessary to determine quality data code. Once you capture those information, you can send the data electronically to MTBC through our EMR, or if you are our scanning practices, then you can send those bills along, so send those forms along super bills. We will apply the applicable quality data code on the claims and submit the data to CMS for you. We will also keep you updated on your progress throughout the year. And in this way, if everything goes according to plan, you will not only avoid the penalty in 2015, but you will also be eligible for the bonus in 2013.
Thank you, Faisal. And dear participants, now we will be taking questions. And once again, on your webinar panel. You can simply type in your questions and hit the submit button. I will give a small pause over here so that we can retrieve your questions that have been asked, and we will be getting back to them shortly. All right, thank you, everyone. Now, the first question that we have received is that it has been asked if there are only two options, that is penalty or incentive, or do we have more options? So that's correct. We only have two options. Either you can qualify for the incentive or you can avoid the penalty. Another question that we have that the practice is a group practice, but they currently have one provider. So can they submit as a group? No. There's a minimum number of 2 eligible professionals that are required to report as a group. Okay, and let me retrieve more questions. Okay, another question that we have is that a provider who is going to start a new practice and they submit claims as group practice with reassignment of benefits. So it's been asked that if this will interface with submitting as an individual. No, it will not. As a group practice, you can allow your provider to participate as an individual. Yeah, there are a lot of questions being asked about this presentation, and yes, a video of this presentation would be available on our website, and the website would be mtbc.com/webinars.aspx. Once again, if you log on to www.mtbc.com, you will be able to find a section of webinars. Within 2 days, this presentation will be available on our website. Okay, we are getting more questions, and another question that we have received is that when to get started and how to go along with this process. Is MTBC going to contact them and to set up a user interface? Well, in this case, for our existing client, MTBC will soon contact them for the PQRS reporting options and how they can report for that, and we will also assist you throughout the whole process. Okay, another question that we have is a professional uses dictation for the charts through the EMR program, and it's been asked that would this affect the PQRS guidelines or not? No, it certainly will not affect the guidelines. It's totally dependent on the physicians, how they are using their, or the providers, how they are using their EMR programs. It's just about submitting it through the claim-based and providing those codes in order to report successfully.
Okay, thanks, Kash. Let me answer some of the questions. And the one we just received is one of the participants said that he came in late, and one of the options he heard is about the submission of 30 patients' data to comply with this PQRS. He's asking either it's instead of 50% patient or they are more or less the same thing. Well, if eligible professional choose Mayer's group reporting option, then they should report it on 20 applicable Medicare Part B fee-for-services patients. So that's in case if you go for Mayer group reporting option. However, if you choose the individual Mayer's reporting option, then there is no defined number. However, it should be minimum 50% satisfactory level, and it's only applicable on Medicare Part B FFS fee-for-services patients.
Okay, another question that we have received is about the charges regarding this PQRS program, and if MTBC is going to assist you, or is MTBC going to charge you for that or not? Well, for our 5% clients, these services will be offered at no additional cost. But those who are just using our system and are submitting their own claims, we will definitely provide them all the material. We will guide them, and again, this won't cost any additional charges for that. Another question that we have is that if we can help PQRS to report for 2012, well, actually this is not possible under the claim-based reporting method. And currently, since we are only offering claim-based reporting method, that's why we won't be able to help out for the PQRS in 2012. Okay, and another question is about the registration.
Okay, thanks, Kash. For the registration, if you want to participate as an individual, then no registration is required. However, if you want to go as a group practice, then you should self-nominate yourself by October 15, 2013. And if the physician or physicians extend choose to participate, the required PQRS code will need to be reported on the physician claim form, which is used by the billing professional services to Medicare.
All right, thank you, Faisal, for that. And let's see if we are getting more questions. And yes, we do have received more questions. And the question is, when can those measures be available to be downloaded? And since they are, or if there are any few measures for the psychiatrists, well, the measures will be defined by CMS, and the PQRS 2013 has 13 quality measures for psychiatrists. So you have to report a minimum of 3 to qualify for the incentive or to avoid the penalty. And also, you can get more information through different websites. For instance, that would be psychiatry.org. All the relevant information will be available on the website. Okay, and it's been asked what is an example of a measure. Basically, the eligible quality measures under PQRS are listed on the CMS website and are not specialty specific. For instance, a provider does not have to be a cardiologist to report on given aspirin to a patient with acute myocardial infarction. In addition, CMS will allow more than one participating provider to report on quality codes on the same patient. All right, and we will be getting more questions. Okay, as a solo practice, would Medicare thinks that the providers is, okay, I believe this has been asked that the practice is a solo, but Medicare believes that it's a group. So how the registration will take effect, like are they going to register as a group or an individual? Well, once again, we would like to tell you that the professionals can participate in both ways. Either they can go as a group or as an individual. Specifically for the group practices, CMS allows them to participate as an individuals as well. So those who are individual, definitely they just have to go as individual majors, but those who are as a group, they have the option to go either as an individual or they can go as major groups. Okay, and another question that we have is that does MTBC has any programs for specialists that need to report for PQRS? Yes, since there are around 20 majors applicable for specialty that is rheumatology, and in PQRS 13, there are around 20 majors that are applicable for that as specialty. And, you know, so based on that, definitely we will have a list of majors that will be applicable for almost all the known specialties. Okay. And, yeah, another question is, what is the deadline to participate in this program?
Thank you. My name is Saad.
Yeah, for the individual providers, although they do not need to register themselves, but the reporting period is this calendar year starting from January 1st till December 31st, 2013. However, for the group practices, the deadline is October 15, 2013, and also the administrative claim-based reporting option, in which you can participate either as a group or as an individual, but it does require registration, and that had been done before January 2015.
All right, and another question that we have is that if a practice, especially the group practice, if they adopt as a group measure initially, can they go as an individual later on? So no, that is not possible as per the guidelines by CMS. Currently, that is not possible. If a practice is adopting to go as a group, they have to participate as a group practice, or if they have adopted as an individual, then they must go as an individual. This is not, you know, interchangeable process. They just have to, you know, keep in mind at the beginning what option they have to select. Since that is not reversible, it cannot be changed, so it's important. That's the part where MTBC is going to assist you, since we will be reaching out the providers and we will be explaining them what best option suits their practice, and in that way they can hopefully earn an incentive or can avoid the penalty easily. All right, so let us look for more questions, and I believe we're not getting any further question. Okay, I believe these are the questions that were asked, and on your screens you can see that if there are any further questions that you believe you need to ask, you can always contact us at info@mtbc.com, and as soon as we're going to get a question, we will be answering it in a first available time. And at this time, we would like to thank all the participants for joining this webinar.
Thank you, everyone.
Once again, thank you very much, and have a great day. Goodbye.
Goodbye.